But first of all, let's address some of these concerns. What sort of information is out there right now in terms of pets and the spread of COVID-19?
Well, I'd say currently right now there's probably some confusion. I know that there's some mixed media discussing that there are a few animals that have indeed tested positive for this current strain of COVID-19. However, there are no companion animals here in the United States that have tested positive, nor are proven to spread or transmit the disease. So I think that first thing is to just make sure you're listening to a good trusted source of information, but to also kind of recircle back to maybe a veterinary professional or to some local state experts to make sure that you indeed do not need to be concerned. At this time, fortunately enough, we are not at risk from our own pets. So here at the vet office, we are also not at risk for getting COVID from our patients, but families can also kind of sit tight right now because this current strain does not seem to be a concern as far as they go.
And I think it's really interesting, too, as this goes on, we learn more and more about this virus. And there's even this COVID-2 strain. So as more information becomes available, that's obviously helping you do your job a little bit easier.
Yes, and the strain's actually, interesting enough, animals go back to having coronavirus. There's actually a canine coronavirus, which is a different strain, and that's something that we cannot catch. But we've routinely vaccinated for years. We've just never really talked about it. From there, cats are also probably more susceptible. They're trying to research-wise prove, as well as ferrets, to this current strain. But cats can come down with their own version of coronavirus, which leads to a condition which some families may have heard of, which is called FIP. So the newest strain, which now they, yes, have termed as SARS-CoV-2, leading to the COVID-19 that we're all kind of in our social distancing time from, right now, at this point, is not anything that our pets can transmit or get. It is a different strain. So if you Google coronavirus and pets, there might be some misleading information, so you have to be very, very careful.
And because of that misleading information, people may be wondering how they should be behaving day to day with their pets around the house. But what's the takeaway here for consumers? If you are concerned about your health, your pet's health, should we just proceed business as usual at home with our typical pet activities, taking them out in the neighborhood, cuddling with them at home?
That's a great question. And it's asked here actually quite a bit by even some of our clients. As we are also trying to social distance, we got to remember if we're out and about that right now veterinary medicine is also a little bit different. The request is that clinics are doing essential procedures, thereby they're probably not doing our routine wellness visits and exams the way normally we would on schedule. So if your pet does come, say, in a nose-to-nose contact in a innocent situation, even out on a walk, your pet also might now contact a dog that's still lacking some boosters. So it's a good idea as we distance that we also keep our pets distance from other animals during this time. But be aware, if we become sick or have a house member that's sick, just like with our children, we wouldn't go and lovey-dovey on them and pick our children to snuggle with. And even though our pets do not get COVID right now, the strain has changed. So to be on the safest side and to protect from anything that might come up as a new development, I wouldn't also take those pets into bed with me if you don't feel well, and probably select another family member to take charge of their daily husbandry, or even when they come to the vet's office, probably not send the sick house member with them. Maybe we can chat with them by phone, which is exactly how we're doing things here, which is a little different. We actually meet with you by phone. My staff go out in gear, including face masks, and so we're trying to minimize contact to protect us, but also to protect families to families, because we're having to talk to quite a few families, and that way we're not at risk of transmitting anything from, client to client as well. But when you're out and about, keep a safe distance and keep your pets safe. Our number one cause here for issues at the ER is actually dog bites and dog attacks. So that's the second reason to keep your pets well away from other ones. But for the safest of everyone is primarily to stay home, as they've recommended, and just find safe things to do outside. It is hot, so be careful with the heat, but maybe stay indoors and just find safe activities, chewies, rawhides, and just make sure that everyone is staying busy while we're riding out this different time.
And we should mention, too, that like our dog Oscar was due for his next round of shots, and that vet appointment was kept. It was just different, no contact. But those appointments are still being met, and those things should still be taken seriously. If your dog needs some sort of vaccination or has been injured, you're still able to do those things right now.
Yes, and definitely things are more towards the essentials. So sick patients, painful patients. If there's imminent death, then we're concerned, like a collapsed patient, absolutely veterinary offices will see that. Things that are really chalked up to a very well-balanced, healthy adult, already vaccinated pet who's just needing some boosters and sort of a re-eval, probably safest to wait till next month, but every clinic is doing something different. So talk to your veterinarian first and see what their current protocol is, but don't be surprised if they want to see, VP or Fido next month, and they're also trying to keep their staff safe and thin so that we are all just kind of following the mandates and doing really what's most essential right now.
Well, Dr. Jennifer Hennessey with Animal ER of Northwest Houston, it's always great to see you, this time through Zoom. So we appreciate you being part of Houston Life, and hopefully we'll see you soon in the studio.
Thank you. Thank y'all so much.
And to connect with Dr. Hennessey, go to our website and click on the Scene on Houston Life section.
All right, and coming up next on Houston Life.